Welcome to The Explainer. Today, we're jumping into a debate that happens in hospitals and pharmacies every single day. And believe it or not, it all comes down to just two little letters, D-R.
So, can your pharmacist be called doctor? Well, the short answer, yeah, they can. Most pharmacists now have a doctorate. But, and this is the important part, the real story here is so much bigger than just a degree. It's about how healthcare is changing, it's about professional identity, and really what it even means to be an expert in today's super complex medical world.
And that really gets us to the heart of the conflict, right? On one hand, you've got this hard-earned, rigorous academic title. On the other, the very real possibility that it could confuse patients. So you've got this clash between professional recognition and public clarity. Okay, let's really get into it.
So to really wrap our heads around this whole debate, we've got to go back and look at the degree itself. See, this title, Doctor of Pharmacy, it didn't just pop up overnight. Nope, it's actually the result of this long, deliberate evolution of the entire pharmacy profession.
All right, so what exactly is a Doctor of Pharmacy, or a Pharm.D? Well, it's what's known as a professional doctorate. A great way to think about it is like a law degree, a JD, or a degree for a dentist, a DDS. The whole point is to train experts for hands-on, direct patient care. It's all about clinical skills, which is different from a PhD, which is more focused on pure academic research.
And like I said, this shift took a long time. I mean, look at this timeline. It really kicked off way back in 1955. But then in the 60s, there was this kind of scary realization that medication errors were a huge, and I mean huge, problem. The profession realized they couldn't just be about counting pills anymore, they had to evolve into experts who manage a patient's entire medication plan. And this all led up to 2004, which was the big year the Pharm.D became the required, standard degree for every new pharmacist out there.
Now, while the US might have been one of the first to make this move, it for sure wasn't just an American thing. It quickly turned into a global trend. Turns out, the need for pharmacists to be true clinical drug experts, that's a worldwide issue.
And you can see it right here. This transition started happening all over the world. You've got countries like Pakistan, Japan, South Korea, Thailand. They all recognized this need and upgraded their pharmacy education. The doctorate basically became the new international standard to keep up with the demands of modern medicine. Okay, so if the Pharm.D is a global standard and the training is tougher than ever, what's the problem? Right? Why is the simple title doctor so controversial? Well, this is where things get really interesting.
All right, let's look at the argument for using the title. For people who support it, it's pretty straightforward. First, it's about recognition. You've got this title that acknowledges years of intense, specialized education. Second, it puts them on equal footing professionally with other doctors, like dentists or physical therapists. And finally, they argue it actually makes things clearer for the patient by pointing out exactly who the medication expert on the team is.
But, and this is a big but, here's the other side of the coin. Patient confusion is a real, documented problem. Just look at this number. A survey from 2010 found that only about 51% of patients, that's just half, found it easy to tell who was a licensed medical doctor. So the concern is, if you add more people with the title doctor into that environment, does it just make things even more confusing? And this quote really nails the issue. It says that in a healthcare setting, when we, the public, hear the word doctor, we usually think of one specific person, the one who gives a diagnosis and leads the treatment, right? That's a really powerful, deeply ingrained idea in the public mind, and you can't just ignore it. So, to deal with this, a lot of places have put laws in place to try and find a middle ground. Kentucky is a great example. Their law basically says, okay, you can use the title doctor, but you have to follow it up with the letters that show your specific degree, like Pharm.D. And, this is key, you can't just stick the Pharm.D in tiny print. It has to be legible almost as big as the doctor itself, so everything is crystal clear. You know, beyond all the laws and the professional arguments, this whole thing gets really personal for pharmacists. I mean, we're talking about pride, family dynamics, and just plain old professional respect.
And for some, it's actually a source of a lot of stress. Take this Reddit user, who says they feel pretentious and inadequate at the same time. Can you imagine? They're caught on this weird spot. They're proud of what they accomplished, but they're also worried about how they'll be perceived, especially in social situations.
But then, on the complete flip side, you have this experience. For this person, the struggle isn't about feeling pretentious, it's about their own family telling them they're not a real doctor. Think about how hurtful and invalidating that must feel after all that hard work. In this comment, "you earn that shit,"
really sums up the feeling from so many in the community. It's just this powerful, simple statement. Be proud of what you've earned.
And this right here, man, this perfectly captures the divide, even among healthcare professionals themselves. Check this out. On one side, you have a pharmacy professor, someone who literally teaches the degree, telling a student it's not a real doctorate. But on the other side, you have a physician who makes a point to introduce the pharmacist as doctor to the patients. Why? To show respect and highlight their expertise on the team. It's just night and day.
Okay, let's zoom out for a second, because this debate, it's not just about pharmacists. It's really a window into a much bigger change happening across all of healthcare. We're moving away from the idea of a single doctor calling all the shots to a whole team of different specialists working together.
I mean, the Pharm.D is just one piece of the puzzle. Now we have doctors of nursing practice, doctors of physical therapy, doctors of audiology, the list goes on. It's all part of this bigger trend. As medicine gets more and more specialized, the training to become an expert in any one of those fields has to get more advanced too.
So at the end of the day, maybe the title itself isn't the real problem. The real challenge, the most important thing, is making sure the patient knows exactly who is doing what. As our healthcare teams get bigger and more complex, patients need to be able to understand in a heartbeat who each person is and what their role is. And that leaves us with the big final question, doesn't it? As our healthcare teams keep growing, how do we strike that perfect balance between recognizing professional achievement and making sure patients are never, ever confused? That's the real takeaway here, because how we answer that question, well, it's not just going to shape the future for pharmacists, it's going to shape the future of healthcare for every single one of us.